Good afternoon. First, I want to apologize for my forgotten and rusty English and my catastrophic pronunciation. So you will have funny for a few minutes. Only I want to do an introduction before the presentation of Maria because of to put panorama in the map of the hospital. And I would explain that what is Panorama project. The question is, what's Panorama? Panorama is the change we thought that internal medicine needed, and it's a project in which all physicians of internal medicine service have been working at least for 2 years, and of course led by our director of service, Gianni Lucchetti. And in the beginning, when we developed the idea of how should our service should be, in the way to offer a better and more actualized care in realistic conditions, so we followed this objective. That is to improve internal medicine healthcare offer, not losing quality. Instead of this, trying to improve it and obtaining some benefits in it. So I think, in my point of view, three critical points appeared in the initial approach. First, there is medical strong evidence of benefits of some specific forms of medical attention, like daycare hospital and rapid diagnosis unit, which should be incorporated as forms of care in internal medicine service. Second, most of us believe that a closer contact with primary care gets more benefits, not only improving patient flow, but also can optimize resources. And our service have already led some initiative with primary attention that have demonstrated good results. And finally, we thought that a better coordination between different healthcare services were possible. In fact, coordination is really complicated, but it's true that some connections between services are very hypertrophied, while others are very underused. So we think that internal medicine could help in improving this efficiency of this coordination. Obviously, this is only an orientative picture trying to explain the idea I want to send. Finally, the Panorama project was achieved, and its implementation began on the past May. And the main key points in the implementation are daycare hospital to attend the decompensated chronic patients, the rapid diagnosis unit to attend patients with serious illness suspicious, and in last place, but maybe the most important, is the intensified contact with primary care, having more direct communication via mail or phone, and having regular meetings in ambulatory. At the end, said that the presentation next will talk about the work done exclusively in the daycare hospital, and it was a decision for logistic reasons in the design of the final degree work. So let's now do the main event. As you know, some of the physicians in the hospital are also teaching in the Faculty of Medicine of the Universitat of Girona, but for first time, a last year student has chosen this hospital to do the final degree work. This student is Maria Baldà, last year student of medicine. She's from Vic and lives here. And I met her 4 years ago when he were done second year in the faculty, and has been very nice to find again now. So the final degree rotation consisted in to be incorporated in the daycare hospital routine. She visited chronic patients, has done diagnosis valorations, has assisted to emergency department and primary care meetings, and finally he did the final degree project, which she will present now. And finally, to say that she has shown very good attitudes and predisposition in acquiring medicine abilities. Also, say that I'm very proud of her work with us, and I think she have a promising professional future, because she has everything that is needed to enjoy the profession and to become a good physician. So, Maria, your turn.
Well, good afternoon. My name is Maria Baldà. As Xavi said, I'm studying the last course of medicine in Universitat of Girona. And since I am studying the last course, I had to do my final degree project. And I was really lucky because the university gave us the possibility to choose where did we wanted to do our final degree project. And well, I chose the Hospital de Vic for two reasons. The main reason is because I'm from here, I'm from Vic. And the second reason is that I did some practicals in the summer of 2013 here also in Vic, and I enjoyed it so much. So I chose the Hospital University de Vic to do my final degree project. This involved to do 2 months of practicals and also a written project. And well, during my practicals here in the daycare hospital, I was allowed to do so many things, so I have learned so much. First of all, every day at 8 o'clock, I assisted to the emergency department handover. Also, during all the day, I accompanied the doctor to the main services of the hospital to get in contact with them and to get some help from them. Also, I was allowed to do some medical history and physical exploration of the patient, and this allowed me also to do some medical reports of the attended patients in the daycare hospital. I also was allowed to request some medical tests and treatments with a reasonable judgment under the supervision of Dr. Pla. I also did so many evacuative paracentesis. I'm really an expert to do that. And well, I also accompanied the Dr. Pla to so many primary care services, and well, I could see all the contact that had the daycare hospital with the primary care service. That it's one of the key points of the Panorama program. So I also had to do written projects, and which we choose the topic of the daycare hospital. We wanted to evaluate how our medical polyvalent daycare hospital works. So we wanted to evaluate if there has been a reduction of hospitalizations and hospitable stays since the daycare hospital has been working. First of all, let's talk about what are medical daycare hospitals, that are medical healthcare units where attended patients that need diagnostic methods or treatments that last a few hours of attention, but these patients that do not need to sleep in the hospital. Characteristically, they allow attending the patients with major comfort, are closed during the night and the weekends, and provide multiple advantages. First of all, to the patient, they give a better quality of life. Also, they reduce the potential adverse effects of the hospitalizations and give a more personalized, focused, and specialized medical attention. The medical daycare hospital here in this hospital treats patients with prevalent chronic pathologies that have a high risk of suffering exacerbations, moderate to severe exacerbations, and are treated patients with three main diseases that are chronic pneumopathies, heart failure, and liver cirrhosis. We did some research of the bibliography of the daycare hospitals in Spain and worldwide, and well, what we obtained is that there are two types of daycare hospital: the generalized or polyvalent daycare hospitals, and also the daycare hospitals of concrete specialization. Both types of daycare hospitals reduce the hospitalizations and hospitable stays, but there haven't been compared both types. So we designed a study to evaluate our daycare hospital, and first of all, we wanted to evaluate two parameters: the number of hospitalizations and the hospitable stays. We have been evaluating these two main parameters in 2 periods of time. The post-daycare hospital period that has been for only 6 months, because I finally presented my final degree project on November, so we only could collect the data from May to October. And we collected the data of the patients from May to October. So the data collected was from 1 month to 6 months. And also we collected the same data of the same patients, but in the period of time that the daycare hospital wasn't open. We also collected other parameters, like the attention to the ER, to the emergency room, also in the 2 periods of time, during the daycare hospital opening and the previous time. Also, we took some demographic data of the patients to know which kind of patients do we have. And also, we collected some data from the Google Flow Trends application and ClickView application, and I will talk to you later about that. So we had as the main hypothesis that the medical attention of the patients with chronic advanced diseases, concretely the 3 diseases that we treat in our daycare hospital, reduces the number of hospitalizations, hospitable stays, and the attentions to the ER. Also, we had as another hypothesis to know if the medical attention of the patients with chronic advanced diseases in the daycare hospital reduces the global number of medical hospitalizations. So we are talking about the global number of hospitalizations of the whole hospital. So related to our 4 hypotheses, we had 5 objectives that were to determine if the number of hospitalizations, hospitable stays, and attentions to the ER with the opening of the daycare hospital has been reduced or not. Also, we wanted to determine if the global number of hospitalizations and hospitable stays in all the hospital has been reduced since the daycare hospital has been open and the Panorama program implemented. And the last objective that we had, and it is more personal, is to know the characteristics of the attended patients that come to our daycare hospital. So we designed a study that has been a retrospective observational study of before and after intervention, and we have collected the data of hospitalizations and the ER attentions during the 2 periods of time that I told you before, that were from the post-daycare hospital opening, so it was from May to October, and the pre-daycare hospital opening, that was to collect the same data, but in the same month, but in the previous time that the daycare hospital wasn't open. So we finally took a sample of 78 subjects that were all the patients that came to our daycare hospital, and we used a sample selection that has been consecutive non-probabilistic. We have been working for 4 months, approximately. First of all, in August, we started with the bibliographic research. Then on September, we started with the phase of coordination when we designed our study. On October, we started with the data compilation of our patients, and finally, on October and November, we started to do our statistical analysis. The limitations of our study, first of all, the study design, because the results obtained in our study doesn't allow us to say that the reduction of hospitalizations is only due to the daycare hospital opening. Also, there are confusional variables like viral epidemics, air pollution changes, season changes that can affect to the diseases that our patients have and can worsen the situation of our patients. Also, the sampling, because has been consecutive non-probabilistic, and that means that it cannot be representative of all the population. Also the Panorama program, because the daycare hospital is only one tool of the Panorama program, and the Panorama program tries to reduce the number of hospitalizations in the whole hospital. So it's not only due to the daycare hospital that the hospitalizations can be reduced. Also the progression of the disease, because as I told you before, there are chronic diseases that can suffer multiple exacerbations and progress in time. And finally, that we have been observing our patients for a reduced time, only 6 months of the opening of daycare hospital and 6 months previously. So the obtained results, first of all, we have been studying 78 patients that they have an average age of nearly 72 years old, and most of them were men, 64% were men. The medical device, the most prevalent medical device that has derivated the patients to the daycare hospital has been the primary care, with 29 patients. So the contact with the primary care that we thought that it was really important, here it confirms us our hypothesis. Also, we saw that most of our patients had from one or more comorbidities, so that their basal situation was not easy to treat. And well, as you can see here, the most frequent comorbidity of our patients has been the high blood pressure. Also, from our 78 patients, the most prevalent disease of our patients has been the heart failure, with 39 patients. And when we have disclosed our results for each disease, we have seen that our patients with pulmonary disease, well, the most prevalent phenotype that they had was the chronic obstructive pulmonary disease, and they had many characteristics that can worsen their situation. Also, they were treated with so many basal treatments. Most of them, they had multiple combinations of treatments. Our patients with liver cirrhosis, the main etiology, and that's a big impacting, is the alcohol. And they came to the daycare hospital with multiple previous complications. The most prevalent were dermatocytic decompensation and esophageal varicose. Also, we calculated the child pack index and the MELT index to see which was the basal situation of our patients. And as you can see here, most of them had a child B, and 2 of our patients had more than 19 points in the MELT index. During their exacerbation, we did so many different therapeutic measures. Most prevalent were evacuative paracentesis, intravenous albumins, and give them oral diuretics. And finally, the patients with heart failure that have been the most frequent disease. The main etiologies were ischemic cardiopathy and severe valvulopathy, and the mean of the ejection fraction of the left ventricle of our patients has been 51%. In 15 patients, they had less than 50% of the ejection fraction. And well, during the exacerbation, they also have been given so many medical therapeutic combinations. And well, the most frequent therapeutic measures has been the diuretics, oral or intravenous, and well, most of them have been receiving multiple combination of therapies. Also, we have collected 4 exitus from the 78 patients. 3 of these exitus were related to their main diseases, their basal diseases, and 1 of them not. So, the obtained results, first of all, we have to say that from these 78 patients, they did 270 visits in the daycare hospital, and we have been following them from with a bit more than 2 months. That's the mean. And when of our attended patients in the daycare hospital, when we have seen the hospitalizations of these patients, before the daycare hospital wasn't open, as you can see here, there were 64 hospitalizations. While after the daycare hospital opening, there were 31 hospitalizations. That means a reduction of more than 50% with a statistical signification, as you can see here. When we have collected the hospitable stays of our patients, before the daycare hospital opening, there were 247. And after that, after the daycare hospital opening, were 99. That means a reduction of hardly 60% of the hospitable stays, also with a statistical signification. And finally, when we collected the emergency room attentions, we have seen that before the daycare hospital opening, there were 99 attentions to the ER, and after the daycare hospital opening, there were 47. That means a reduction of more than 50% of the emergency room attentions, also with statistical signification. Then we took the ClickView application to see if the global number of hospitalizations and hospitable stays of the whole hospital has been reduced or not. First of all, we took the hospitalizations and hospitable stays of the first 4 months of 2015, from January to April, and we compared with the 2 last years. And as you can see here, the number of hospitalizations and hospitable stays in 2015 from January to April was higher than the last 2 years. That means that there was a trend to increase the number of hospitalizations in the first month of 2015. Then we thought that this could be one of these reasons could be the flu. So we took the Google Flu Trend application, and we took the flu trend application shows us the trend to consult because of the flu to the doctor. And we took the data from Catalonia in the first 4 months also. And as we can see here, in 2015, there was a trend also to increase the number of consultants because of flu to the doctor. So it could be a reason of the increased trend to have more hospitalizations. Then, with the ClickView application, we took the data from the hospitalization and hospitable stays of the 6 months of 2015 that we have been evaluating our daycare hospital, from May to October. And as we can see here in green, the number of hospitalizations has been reduced in comparison to the last 2 years in the month that the daycare hospital has been opened. And as you can see here, the reduction is more important from July to October. Also, the hospital stays, in green also in the other chart, has been reduced also in this month, and it has been more important from July to October also in comparison to the last 2 years. So, we took the data of hospitalizations and hospital stays from July to October, that have been the 4 months with more reduction of hospitalization and hospital stays, and we have compared the data from 2015 with the 2 last years. First of all, we compared the number of hospitalizations from 2013 and 2014 to see if there is a difference or not. And as you can see here, the difference between 2013 and 2015, the number of hospitalizations has not been really important. And there is no significant statistical signification. But when we took the data of hospitalizations in 2015 in these 4 months, and we compared with 2013 and 2014, we can see here that there is a difference, an important difference. When we see the hospitalizations in 2015 in comparison to 2013, the difference is important. And when we and we can see that it has a statistical signification, this difference of the number of hospitalizations. We also compared with the hospitalization of 2014, and as you can see here, there is also a difference. This time it doesn't have a statistical signification, but it is nearly to have it. Also, when we compared with hospitable stays between the data of 2013 and 2014, there is no so much difference, and it has not a statistical signification. But when we compared the data of hospitable stays in 2015 in comparison to 2013, as you can see here, there is an important difference, and it has a statistical signification. But when we compared with 2014, the difference, it was also important, but it doesn't have a statistical signification, but is nearly to have it. So we concluded that, first of all, the most frequent attended pathology has been the heart failure in our daycare hospital. Also that the most frequent derivation device has been the primary care, so it is an important point in the Panorama program. Also that there has been a reduction of the hospitalizations and hospitable stays of the patients that have been attended in our daycare hospital. And the problem is that we cannot affirm that this reduction is only due to the daycare hospital opening. Why? Because there are some confusional variables, and also because there is the Panorama program that tries to avoid, to reduce the hospitalizations in the whole hospital. So the daycare hospital is only one of the tools of the Panorama program. Also, the type of study that we have done doesn't allow us to infer causality, because the results have not been compared to a group of patients that has not been included to the daycare hospital. We also have seen that there has been a flu epidemic in the first 4 months of 2015. So there was a trend also to have more hospitalizations in the first 4 months of 2015 in comparison to the last 2 years. And also there has been a reduction of the general number of hospitalizations and hospital stays in 2015. And this reduction is more important than it seems because of the trend of the first 4 months of 2015, that the hospitalizations were increasing. Also, there has been a reduction of the general hospitalizations and hospital stays, especially in the last 4 months of the daycare hospital opening, from July to October. And finally, it's that there has been a reduction of the hospitalizations and hospital stays during the period in which the daycare hospital has been working at 100% in comparison to the 2 previous years. We know that it is necessary to complete this study with the data of the first year to see results in the long term. Then the results will be able to be removed per month and per patient. So thank you for your attention, and now if you have any questions.